Hey, Dr. AJ here. If you're trying to raise your ferritin, you probably know it can feel like this frustrating uphill battle. But what if a few simple changes could make a huge difference? In this explainer, I'm going to walk you through 3 practical, evidence-based tips to help you absorb iron way more effectively. This is such a common struggle. You feel like you're doing everything right. You're taking your supplements every day, but those lab numbers just barely budge. It is so easy to feel like you're doing something wrong. But the truth is, iron absorption is just a really tricky business, and your body follows a very specific set of rules. So let's go ahead and demystify them. So here's the game plan. We're going to cover 3 key strategies. First, mastering the timing of when you take your supplement. Second, creating the perfect conditions for absorption. And third, and this one is crucial, learning what to avoid. By the end of this, you're going to have a clear, actionable plan. Okay, before we really dive in, just a quick but really important reminder, this explainer is for educational purposes only. Please always work directly with your doctor and follow their specific medical advice for your personal health needs. All right, so before we even get to tip number 1, we've got to lay a little groundwork. It is absolutely essential that you understand the 2 main types of iron supplements, because how you should take them can be completely different. So the 2 categories you're going to hear about are non-heme iron and heme iron. Now, most of the tips we're about to discuss are specifically designed to make that non-heme iron work better, mainly because it's the most common type out there, and frankly, it's the one that needs the most help. So first up, let's talk about non-heme iron. This is the kind you'll find in most supplements on the shelf. It's inexpensive, it's widely available, and it's usually the first one a doctor will prescribe. It's derived from plant sources, and if you look at the label, you'll see it listed as things like ferrous sulfate or ferrous gluconate. And then on the other side of the coin, you have heme iron. This type comes from animal sources, and its biggest advantage is that it's absorbed much, much more easily by your body. And as we're about to see, it's not nearly as fussy about what you eat or drink along with it. Okay, let's break this down because this table really lays it all out. You've got non-heme on one side. It's plant-based, but here's the catch. Its absorption is very easily blocked, and it's way more likely to cause those annoying side effects like constipation or an upset stomach. Then you have heme iron. It's animal-based, absorbed much better, has fewer side effects, but it typically comes with a higher price tag. All right, let's get into our first practical tip. And honestly, this one is a big one. More than almost any other supplement I can think of, when it comes to iron absorption, timing is absolutely everything. Here it is, the golden rule. Take your iron supplement first thing in the morning. Your body is biologically primed to absorb iron more effectively early in the day. And there's a really fascinating reason for this, and it all has to do with one key hormone. And that hormone is called hepcidin. The best way to think of hepcidin is as your body's own little iron gatekeeper. See, your hepcidin levels are naturally at their lowest point in the morning, and they slowly rise all day long. So by the afternoon, that gatekeeper is actively blocking iron from getting in. Taking your supplement first thing in the morning means you're slipping that iron in before the gate really starts to close. So what does this look like in real life? It's a super simple routine. Step 1, wake up. Step 2, take your iron supplement with a glass of water. And step 3, and this part is key, wait at least 30 minutes before you have your first meal or that first cup of coffee. This gives your body a clean, low hepcidin window for maximum absorption. Okay, so now that we've got the timing down, our second tip really builds on that. It's all about creating the ideal chemical environment inside your gut so that iron can actually be absorbed properly. Here's the thing about non-heme iron, that common plant-based kind. It's kind of like a superhero that needs a sidekick to really unlock its powers. And its perfect sidekick is vitamin C. So, why is vitamin C such a game changer here? Well, a couple of reasons. For one, it creates a more acidic environment in your stomach, which non-heme iron desperately needs to be broken down. It also chemically changes the iron into a form that's way easier for your intestinal cells to grab onto. And as a fantastic little bonus, a lot of people find that taking vitamin C with their iron actually helps reduce those digestive side effects like nausea. And putting this into practice could not be easier. When you take your non-heme iron pill in the morning, just take it with a 250 to 500 milligram vitamin C supplement. Or you could even just drink a small 4 to 8 ounce glass of orange juice. This simple little pairing can dramatically increase how much iron your body actually gets to use. All right, and for our final tip, we need to talk about what not to do.
And believe me, this can be the trickiest part of the puzzle. But for non-heme iron, it might just be the most important part of all.
The big rule here is to take your non-heme iron on a completely empty stomach. And I know, this can be the toughest one to follow, especially when you are craving that morning coffee or breakfast. But the reason is that there's a surprisingly long list of everyday foods and drinks that actively block iron absorption. And just look at this list. What's so wild is how many of these are part of a normal, even healthy daily routine. We're talking about things like the tannins in coffee and tea, and of course the calcium in dairy like milk or yogurt. But it also includes healthy stuff like whole grains, nuts, and eggs, and even things like antacids or thyroid medication. All of these can literally bind to that non-heme iron and prevent it from ever entering your bloodstream. So, what does on an empty stomach actually mean in practice? Let's get specific because it's important. This slide lays out the two options you have. You either take your iron supplement at least 1 full hour before you eat or drink anything besides water, or the other option is to take it at least 2 full hours after you've finished a meal. Following this rule gives that iron a totally clear runway for absorption. So let's put it all together. This is your new strategy. Take your non-heme iron first thing in the morning, pair it with some vitamin C, and wait at least an hour before you eat. But you know, the real secret sauce here, it's consistency. It can still take several months to see a really significant rise in your ferritin levels, so sticking with this new routine every single day is what will ultimately bring you success. Look, raising your ferritin can feel like a marathon, not a sprint, but it doesn't have to be a frustrating one anymore. You now have a clear, effective strategy to make every single dose count. The only question left is, what's the first change you're going to make tomorrow morning to put this plan into action? Because when it comes to finally feeling better, there is absolutely no better time to start than right now.